Hello everyone, my name is Xiaonan Xu. This is my critical appraisal presentation. First is my content, introduction, background of critical report, and then 4 arguments. My critical report is called Smartphones in Nursing Education. In this report, they show evidence for supporting that smartphones could be used widely in nursing education. But after reading the article, I found there are some points have weak evidence to support it. Smartphones are a new technology used popular with expanded functions and greater internet access. In the article, it talks about the potential uses and issues surrounding the use of smartphones in nursing education. As the functions of other phones, the smartphones could also send text messages and call others. It also could be used for watching videos and accessing to the internet. According to smartphones, recreational, they could be used as a nursing education tool. Smartphones can be used for quick access to educational materials and guidance during clinical class or clinical conference. The smartphone could help the student to review the instructional videos and reach their clinical instructor with text message. One of the most important benefits for using smartphone as education tool that it could be communicate with the instructor and read the reference immediately. But in the article, it mentioned that, however, a 2008 literature review of 73 articles on PDA used in nursing education did not reveal a large controlled trial showing a change in learning outcomes for those students who used PDA technology within their program of study. But according to my research, PDAs are still very useful for nursing education. PDA is a short for Personal Digital Assistant. It is a handheld device that combines computing, telephone, fax, internet, and networking. It is also a very important electrical device for collecting personal data and managing their personal information. From the functions that we could find, PDAs are useful for nursing students to collect the data and manage them. PDAs show more useful in clinical nursing teaching because that the clinical situation needs more data and information, especially for some special disease and nursing consideration is particularly useful. It also could help students to improve their studying skills. The student could submit assignments through PDAs and get the feedback in time. The whole process, they do not need to waste the time on handing the assignments and getting the feedback from the lecturer. We could find the PDAs are still very useful for nursing education from different ways. They could help the students get more data on time for their clinical studying and improve their experience. And it also could be used as an important studying tool for them get the subject digital materials. The argument to PDA literature are very useful. In the article, they mentioned much of the literature on PDAs involves case studies or experience which limits the ability to make concrete recommendations, although the case studies are almost uniformly positive. But I think PDA's literature there still have lots of reports to support the nursing education. They could find the similar case study and then the better treatment at the same time. Nursing is a special job that it needs lots of clinical experience and knowledge. It happens in many environments, including home care, acute care, and the care of community. Nurses in a variety of settings have used PDAs, and the results used have been briefly reported in the literature. According to the Davenport survey, the most important benefit was the ability to quickly access current drug database and nursing reference books. So PDA is a very useful and convenient reference tool. We could find that PDAs really help nursing students to improve their special knowledge, and the students could read the reference books every time they want. They could then exercise at the same time and faster. In the researchers' report, that students believe PDA improved the quality of care given to patients by allowing access to drug information at lab values. The third argument is about the security problem, because in the article they mention the student could be chat with the instructor about the treatment or something on Twitter. But I think it's a problem of security, because all the Twitters users could check others' Twitters, others could look the patient, so others could look the patient's detail. It will be mentioned to the patient privacy. Patient privacy is about the power of patients to decide when, how, and to what extent their health situation is shared with others. It involves maintaining confidently and sharing identifying data and knowing as protected health information only with health care providers and related professionals who need it in order to care for the patient. So if they talk about the patient details on Twitters, it will make the patient it might leakage the patient privacy to others. If it found by the patient, it will make the patients feel the doctors and nurses unbelievable, and they might find something they don't know before. It will be very hard for the doctors and nurses to do the next treatment, and the patient could not believe them deeply. It may be impact other. It maybe have hard impact. It maybe have worse impaction. The fourth argument is the consideration about using smartphone for nursing education. In the article, it shows that the smartphone could be used for nursing education very well and used widely soon. But there are 3 points should be considered at the same time. The first, the teachers could not control students how to use their smartphone. Maybe when they should use the smartphone for studying, they are use the smartphone for social networking or playing games or watching entertainment. Also, when it is very hard for the instructor to define what are the students doing, and the students do not maybe some students do not like smartphone and they think it is not useful for their life, so it will be the cost for them to buy a smartphone. Maybe they prefer to buying some reference books and using them all the time, and the smartphone released very quickly. Just like the iPhone, they release the new item every year. If the student may want to change the smartphone, but how this will be a problem for them to transfer the data in the old smartphone, and the device's security of the enter database is very important problem. because the students may be lost their smartphone, and the others could check the details and of the patients and the data and the information with the student's smartphone. So the smartphones belongs to the student. So the university could not give more policy for controlling the situation. So before the smartphone being used widely, this problem should be considered more and carefully. Thank you.